Hello and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton, and on this segment, we will hear from Sue Babbitt of Denver, Colorado, and how she overcame bladder cancer. Now, we want to remind you before we start that on Cancer Interviews, we do not dispense with medical advice. If you need medical advice, do yourself a favor and please consult with a licensed healthcare professional. So now let's get started. And Sue, welcome to Cancer Interviews.
Thank you, Bruce.
The first thing we want to do, this is standard procedure for any of our interviews. We'd like to get to know you a little better. So if you would, tell us about where you're from, your life's work, and what you like to do with your leisure time.
Okay. Was originally born in Kearney, Nebraska. Excuse me. And was raised in a small town in Nebraska called Amherst, Nebraska. I'm one of 6 children. I'm the oldest daughter, the oldest girl. I have lived several places. I've lived in Nebraska, Kansas, Alabama, and now Denver, Colorado. I'm 70 years old and I'm retired.
Let me ask you this. I would think that coming from small town Nebraska to Denver must have been an adjustment. Was it difficult for you?
Well, I'd lived several places in between those two. Denver, Colorado is the place I wish I'd always lived, actually. I love Denver.
And when did you arrive in Denver? What year?
I moved to Denver in 2008. Yes, I moved to Denver in 2008. My move here was precipitated by the birth of my first grandson. He was born on November 25th of 2007. When he was born with a heart condition called tetralogy of flow, which means that he had 4 things wrong with his heart. He had 2 of those fixed in May of 2008. But I moved here on February 1st of that year because my daughter found out just prior to having to go back to work that Reese could not go to daycare. It was all arranged and everything, but he could not attend daycare because of his heart condition and the fragility of being exposed to all those other German kids. So I moved here to take care of him out of necessity, and I've been here ever since.
And how difficult was the caregiver role for you? What was the biggest challenge?
There really wasn't a big challenge except for, well, I guess the biggest challenge was carrying around the oxygen. He was on oxygen off and on from the time he was born until he had his heart surgery. And during that time in March, my daughter had to go back to her school teaching job. And so I had him 5 days a week. So, and we did everything that everybody else would do. My family is very active. So Reese and I would go all over, but it meant carting a small infant child in a carrier and we had home oxygen, and then we had the small one that I would carry around with him when we went anywhere. So that was probably the most challenging part, was the oxygen.
All right, well, let's talk about your life prior to your being diagnosed. At that time, were there any warning signs, anything that tipped you off that something wasn't normal, something might be wrong?
Well, the reason I started going to the doctor was because I started having blood when I would go to the restroom, and it wasn't in my urine per se, but I had blood when I would, on the tissue that I would use after I had been to the bathroom, which at the time, let's see, in 2012, I was well past menopause. So there was no, and it was different also than than a woman's menstrual cycle. It wasn't like that. I never bled between using the bathroom, but it was there when I used the bathroom. So I started going to the doctor for that, and at first they treated me as if maybe I had an infection. If you go to the doctor, they usually, in my experience at least, start with the easiest, the less frightening, the simplest. So they thought perhaps I had some sort of a infection that was causing the blood. So we treated that. We did actually 2 doses. I did a dose of some kind of antibiotic. It obviously didn't work. So then I went back to the doctor. They tried a different kind of medication. That didn't work. So at that point, my general practitioner decided that they needed to know why I was bleeding, and she ordered a CT scan. So, and that was where they found the mass in my bladder. So that was what was causing the bleeding.
Was there much pain involved?
None. The only symptom I had was the blood. The only symptom ever.
So after that CAT scan, were you referred to a specialist?
I was referred to a urologist. I used the Denver Health hospital system, and I was referred to the urology department there. Dr. Kim was the director of that department, so I went to see him, and they did a probe, saw the mass on an even finer tuned sonogram kind of a thing that they did right in the office, and then scheduled a removal of that mass.
And what was that procedure like when they did that? Did you have to have a general anesthetic?
Yes, they did a general anesthetic in the hospital. They went in and removed the mass, and then I went home. I didn't even have to spend the night, nothing. When I first came out of the anesthesia, from the anesthetic, they said they didn't think that it looked like it was cancerous, that it was malignant. I mean, cancerous, yes, but benign. They thought it was benign. But of course, they sent it into the lab, and then I think it was maybe a week, maybe not even quite a week later, that I got the phone call from one of the urologists at Denver Health, informing me that the pathology came back and it was not good. It was an aggressive form of cancer. They also told me at that time that it appeared to them that the cancer was contained within the walls of the bladder, that it had not metastasized. And so then after that, they set up another appointment for me to come in and talk to the urologist about our options as far as treatment.
And what were those options?
Well, one of the options was, the first option they gave me was chemo, 4 cycles of chemo, 4 rounds of chemo. And then at the end of that, we would just run tests and see where we were, where the cancer was. The second option was, which was the one they actually recommended, was that we did the same chemo treatment, the same 4 rounds. And then at the end of that, I would have my bladder removed and go from there.
And this was a successful procedure, yes?
Yes, everything was successful. Yes, yeah. Denver Health is fantastic.
Now with a removed bladder, how does that manifest itself? How does that change your life?
It changes my life in as much as I no longer have a bladder. I had my bladder removed on October 10th, 2017. And so then I wear a colostomy bag. Wait, is it called a colostomy bag? I'm not sure that it's called a colostomy. I think it's called something else, because it's just the urine that the bag collects. During the surgery, when they remove the bladder, they use part of the bowel to make an ostomy. That's what it is. It's an ostomy bag. I'm sorry that I'm sorry. I know that. Why didn't I say that? Anyway, so they make I have on the side of my stomach an ostomy that comes through my stomach, and that's where the urine comes out of that into a bag that I wear on the side of my stomach. It's not, I mean, it's a little bit of a pain in the, you know what, but it hasn't changed my lifestyle. The first thing that I asked the urologist was, how is that going to change my life? Am I still going to be able to participate in my grandsons' lives? I have two grandsons. Currently, they are 12 and 8, and I play basketball with them. I swim with them. I do everything with them. They're my life. I see them 3 or 4 times a week. I take care of them after school, those 3 or 4 times a week during the school year. We go on vacation together. Most people don't. I mean, if I don't tell you I have an ostomy, you don't know. I mean, it's changed the way I dress, because it is right at the waistline, and I have to wear high-waisted things. I can't wear jeans because they're fine when I'm standing, but when I sit down, you know how a pair of jeans or something with a waist will tighten around the waist when you sit? Well, that's where my ostomy bag connects to me. So that's very uncomfortable. So I don't wear jeans anywhere. All the pants that I wear are pull on. I wear longer tops that cover that then, because as the bag fills, I will get like a lump on that side. But if I wear the right clothes, you don't really even notice it. It definitely has its advantages. I no longer get up in the middle of the night to use the restroom. I sleep all night. I can go on a trip and not use the restroom. I can go without using a restroom for like 4 hours. So that's an advantage. You know, there's the occasional leak, which is very inconvenient and a little embarrassing and all of those things, but they happen rarely. So it really, I have a great life. I have a great life. I would not have changed anything. It's been fine. I do everything I want to do.
So 2-part question regarding pretty much the same subject. Earlier on, we had talked about caregiving when you were the caregiver, but let's go back to the chemo phase of your treatment. Did you have a caregiver or caregivers?
I did have caregivers. First of all, my husband, he was with me the whole way. And of course, he was here at the house after I come home. I was in the hospital for only 8 days after the major surgery that I had. It was a 7-hour surgery. It went very well. The people, the nurses and the doctors at Denver Health were fantastic. And the other person that I had that was by my side 24/7, she didn't miss a chemo treatment, not a single chemo treatment, was my daughter, the mother of my grandsons. Carla and I have always been really, really close. And she was with me. She went to every chemo treatment. She was with me in the hospital when I had my surgery. She actually spent the night with me every night. She was fantastic. My husband refers to her as his angel because of the fact that it was more comfortable for me to have my daughter see some of the things. Bladder cancer is kind of personal, you know, and I wasn't sure, especially in the beginning, that I wanted my husband to see all that. You know what but with Carla, you know, she would stand when I was in the hospital. I would take showers in my, you know, in the bathroom as part of my care, and she would stand in the doorway and watch, and I was comfortable with that. I wasn't always comfortable with my husband seeing all that. You know, I'm 70 years old, so I'm a little, maybe a little shy about some of that stuff that maybe younger women aren't. I don't know. But I really didn't. I was a little hesitant in having my husband see me like that. A little shy, I guess you would call it. So she was there every single minute.
Now, you mentioned caregiving from sort of a medicinal procedure sort of perspective, but what about the emotional piece? How is your husband and how is your daughter as far as that goes?
They were both fantastic. Now, my daughter was with me every time I had every time I was in the hospital, every time I was having chemo, all of that. But in between that, of course, my husband was with me because I was at home. You know, my chemo situation was, the cycles that I had were on once a week for 3 weeks. I would have chemo every Wednesday for 3 weeks. And then that 4th week, I'd be clear. I didn't have anything. And then we'd start the next cycle of 3 weeks on, 1 week off. And we did that 4 times. And if you've ever had chemo, you will know that it builds upon itself. So the first treatment was not horrible. Second treatment was a little bit worse. By the time I got to the 3rd, and especially the 4th, especially the first week of every month, was debilitating. So I would go and have my cancer treatment, and then I would come home and I would be in bed until the next week when I would go to have another treatment. In my case, the first week of every cycle, I got 2 different drugs. And then the second and third week of that cycle, I just got 1 of those drugs. So that first week was really debilitating, really not fun. I never had issues with nausea because the drugs they have nowadays are quite good. They always gave me a nausea medication before they started the chemo. I would get like 15 minutes of that, and then then they would shoot in the bad stuff, the poison, as my husband referred to it. So that first week was kind of rough, but then after that it was fine. It was, you know, the second and third weeks were fine. I even actually went on vacation the week between my second and third cycle, the week that I was off chemo. We do a family vacation every year, and the grandsons and my daughter and her husband and my husband and I, we all go somewhere. And we happened to be going to Costa Rica that year. So we went to Costa Rica and had a great time. I'm glad I did that because the 3rd and 4th cycles were not a lot of fun.
As far as chemo goes, though, it's always depending upon the patient and their circumstance. It's varying degrees of unpleasant, but can you understand why you were treated with chemo? Because it was a necessary evil that it was needed to kill the cancer?
Oh, absolutely. And in fact, did. It did its job. It was highly successful. They didn't know that, of course, until they got in there during the surgery. So after the chemo did its thing, then 6 weeks after that is when I had my first surgery, the bladder removal surgery. So yeah,
So
chemo is nasty, but especially in my case, it was necessary, absolutely necessary. It was, I would do it all again, without a doubt.
Sue, now I said on the subject of caregiving that I had a two-part question. The second part of that question is the managing of the bag and all of that, and because for that I suspect you don't have a caregiver. You are your caregiver as far as that goes. What's the toughest part of the management of the bag?
It's really not tough. The only it's really just not a big deal. I mean, it's frustrating if you have leaks, and my leaks seem to go in cycles. Like I will have a week of like 3 leaks, and then I won't have a leak for 6 weeks, something. I mean, it's really, it's not nearly as big a deal as I thought it was going to be. It really isn't. You know, cancer treatment has come a long, long way. It really has. I am just grateful that my cancer was diagnosed in 2017 and not even 10 years earlier than that. You know, it just keeps getting better. So, you know, they know so much more now. It's just fantastic. And the secret is also quick, fast, early detection. That my cancer was only stage 2. Stage 2 is before it actually it spreads throughout your body. I didn't have it in any lymph nodes, nothing. So it was, once they removed the bladder, I've been cancer free since 2017.
That is fantastic news. And Sue, there's somebody watching right now who perhaps has just been diagnosed with bladder cancer. And I've got to believe that your story is a source of inspiration and encouragement, because it sounds like throughout the cancer journey that you had trust in your doctors, you had a good caregiving team, if you will. And it sounded like, you know, from start to finish, that you had confidence that this was going to have a good outcome.
Oh, yeah, that is part of my personality also. I am extremely stubborn, and I knew from the beginning that I was not going to let this, you know, it wasn't taking me. No, I am tougher than cancer.
Indeed, indeed, and
And
your
I do
experience
think
is
that,
proof positive of that.
yeah, and I have had a lot of people tell me, a lot of my family members told me that they were surprised because I really am the first person in my family to have cancer. So I was not expecting to have to, that was the one thing I really didn't think I needed to worry about. But I've had a good, you know, a good attitude about it, according to other people.
And that's so important, isn't it?
I do believe that is. I do believe that is. You can't let it get you down. You know, it's just, everybody's life has ups and downs, and cancer is one of those downs, but you'll be up again. You know, I've been up now, I would say since January of 2018. You know, the 2017 was not my year. That's what I tell everybody. And, but since then, everything's great. I do whatever I want. It's fantastic.
Now, you'd already mentioned going to Costa Rica, but was there something else you did when it became more than apparent that you had gotten the best of cancer? Anything you did to celebrate?
No, not really. Whenever you have, I had that was a major surgery. And then in addition to that, I had some issues after surgery. I had a UTI in November that put me back in the hospital for like 3 days. And then in December, I got sick again, and I was really, really sick this time, and they had difficulty figuring out where the infection came from. I was septic. It was not good. That almost did get me, but it didn't. I was in the hospital from December 9th to the 22nd of 2017 fighting that infection. But since then, I have not been in the hospital. I have not been sick. I am quite healthy. I'm not, I didn't change my diet. I don't take particularly good care of myself. I'm not on any strict diet. I'm not on, I don't avoid anything really. Everything in moderation is kind of my mantra. But no, I'm doing quite well.
Okay, so we're going to wrap it up here, but I'd like you to visualize somebody who is watching or listening to this now, somebody who's just been diagnosed with bladder cancer. From your experience, if there's one overarching takeaway, any bit of advice you would like to share with that person, what would it be?
Trust in your doctors. Be sure you have good doctors. I do believe that is the most important thing. And trust in your doctors. Bladder cancer has been around forever, and they know what they're doing. They know what they're doing. They're very good at this. Trust in them and believe in yourself. Believe in yourself. You are tougher than cancer.
That's a wonderful story, Sue, and a wonderful message, especially for the person who has just been diagnosed with bladder cancer. So we want to thank you very much for coming on with us on Cancer Interviews.
Thank you for letting me share my story.
Okay. Thank you, Sue, for sharing your journey with us. A difficult one, but it's one that clearly you're handling. And if you are just beginning a bladder cancer journey, we hope you found inspiration from Sue. So that's all for this segment of Cancer Interviews, and we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews podcast.